Hello and welcome to a special interview for The Wire. Hundreds of thousands, if not millions of you, must spend a lot of time finding out about coronavirus. You're reading the papers, watching television, looking up the internet, sharing messages on WhatsApp, and even consulting friends and experts. And as a result, there are bound to be several questions that are now causing concern and crying out for answers. Those are the sort of things I shall put today to one of India's better-known public health consultants, Dr. Deepak Natrajan. Dr. Natrajan, let's start with this critical question: what is the mortality rate of coronavirus? The WHO estimates it as 3.4%. The Italian experience is pretty close to 11%. The German is under 0.8%. So do we have a clear idea of what the mortality rate of the virus is?
No, we don't have a clear idea. Let us be clear on that. This is a grim pandemic, undoubtedly, but the danger is that we should not convert this into a epidemic of hysteria. Let's take the data, right? The Italians have a mortality of 10%, 11%, but their population is very old. The people who have died, the average age is 82 years. Moreover, 99% of the people who have died had chronic diseases. Only 1% were, healthy people. So that's a very sick population. As opposed to that, the Germans have a much younger age group patients, about 43 or 45. Okay, that is the average age. And more importantly, the Germans have checked more people. They have tried to check more positives, more people in their population, whereas the Italians were checking only the people who were sick. So once you have a quantum which is larger, that means the more people you check, the fewer will be the cases.
That's very interesting. But I want to pick up on one of the things you said. 90% of the 10,000 plus people who've died in Italy have had, as you said, other serious ailments.
99%.
99%?
Yes.
And this is what doctors on television call comorbidity.
Exactly.
Does this therefore mean that these are coronavirus deaths, or are they actually better classified as deaths from a combination of causes?
That's a very good question. The Italians themselves have conceded that they have no idea. You see, they cannot distinguish a death by coronavirus from a death with coronavirus. In fact, their death certificates, I think only 12 to 14% certify the cause of death as the coronavirus.
So for the rest of the world to assume that this high mortality rate of nearly 11% in Italy is a direct result of coronavirus is to come to the wrong conclusion, you're suggesting?
Yes, very much.
And you need to bear in mind, A, that a lot of these people are roughly over the age of 80, 81. And secondly, the average age of the Italian population is much higher than the average age of the German population, where the death rate is much, much lower. That is also an influencing critical factor.
Yes, I think that the second oldest population resides in Italy, in the world.
Which makes it very vulnerable.
Very vulnerable.
And
True.
also, I believe, although these may not be confirmed reports, but they've been in newspapers and they've been in WhatsApps, that Italians have also been people with a very large contact with Chinese directly from Wuhan, many of whom actually went back to Wuhan over the Chinese New Year holiday and then came back to Italy because they work there. And at one point of time, according to reports which haven't been confirmed, but they are there on WhatsApp, Italians actually carried out a hugger Chinese campaign to be nice to these workers who were returning to Italy after their New Year holiday.
Now, that could be a very strong possibility.
So that would have had an impact
definitely, yes,
on the Italian death rate.
Yes.
Let me at this point put to you two specific cases which are almost like test cases. The first is the cruise ship, the Diamond Princess.
Right.
How many people were on board that ship? What percentage of that got infected and what percentage of that died?
Now, this cruise ship, you must understand, was a confined area, right? And they had about 3,700 people on board. That includes the crew and passengers. The average age, again, was in the 60s. That's very important. And these people were mingling with one another. That is also very important. Out of these 3,700 people, only 650 or 60 got infected. And of these, I think only 7 have died so far. So the infection rate is about 17%. But this cannot be extrapolated.
And the death rate?
The death rate is less than 1%.
Less than 1%?
Almost 1%.
So even though this is a confined environment where people were mingling and therefore the chance of them infecting each other was a lot more than it would be in a normal city, the actual infection rate is 17%, the death rate is 1 or less than 1%, which is
Right.
actually what the German mortality rate is.
Exactly. The German mortality rate is less than 1%. Even the Koreans have a mortality rate of just about 1%.
And even on the Diamond Princess, which is very different sort of confined condition compared to Germany, nonetheless the mortality rate is 1 or less than 1%.
1%.
Let me put you the second specific example, and that's of Iceland, a country where it's been reported every single citizen has been tested. What percentage of those citizens were found to be infected, and what percentage or number then died?
I think the people affected were just again 1%.
Just 1% were
1%
infected.
have been found to be affected, and it's a fact that only one lady who was 75 years has died. A 75 years old lady has died in Iceland so far.
Is there anything about Iceland that would make it unusual and unique, and therefore grounds for saying that what happened in Iceland doesn't apply to the rest of the world?
No, I think it would be unfair to compare countries because the demographics are very different. You know, India is different, Iceland is different, the temperatures are different, humidity is different, people are different.
Nonetheless, Iceland shows that the rate of infection and the number dead can be very, very low as well.
Very much.
It
Very
doesn't
much.
necessarily
Yes.
have to be
Yes,
the
yes.
Italian equivalent every time.
Definitely.
Let me then come to this. Given the experience we have of the mortality rate in other countries, is it possible for you to get any sense of what will be the percentage infected in India and what will be the percentage after that who sadly die?
Now that's a very difficult question because we don't have the data. We don't have, we don't have that intense surveillance going on right now.
By which you mean we don't have enough testing?
Yes, we don't have enough testing. But from what has been provided, I think 1,000 people have been affected, and less than 30 have died.
It's actually 1,071, and I think the
28 or 29 have died. Right.
This is as of 3 p.m. exactly on Monday.
Which is minuscule. These are very small numbers for a country which has 135 crore people living in it.
So let me understand, what you're saying is, given the low level of testing done in India, using Indian statistics, it's very hard to get any sense or accurate prediction of what the infection rate in India will be and therefore what the mortality rate in India will be. Is that right?
That's right. But also we must keep in mind that the figures which are being provided suggest that the infection rate is not very high. It is not the Italian scenario. It is more like the German scenario, or would be more like the Iceland scenario.
Assuming that the figures being provided are accurate in the sense that the testing
Even roughly accurate,
is sufficient.
Yes.
Let me put a thought to you. The only country in the world that compares to India in terms of scale and size and in terms of density of population is China.
Yes.
China happens to be also the only country
Yes.
where they believe they've actually seen the end of the infection. Now in China, just around 82,000 people got infected. That turns out to be 0.005% of the Chinese population.
Exactly.
And of that 82,000, 3,300 died. Now I know that the Indian health system is nowhere near as advanced or comprehensive as the Chinese. I'm not even for a moment suggesting that. But if you were to take Chinese statistics and say multiply them by 3, then 82,000 infected in China would become
2.5 lakhs
250,000 infected in
in India. And the mortality would go up from 3,000 something to 9,000 or 10,000, even 15,000.
So would that, as a sort of suppositionary ballpark figure, make sense at the moment for India?
Yes, that will give us some sense. That will give us some sense that possibly 10,000 people would die in a span of 5 months, because remember, this thing began in November and we are almost in April now. So therefore, in 5 months' time, we would have about, say, 7,000 to 9,000 deaths, double that, so we still are below 15,000.
This is so important for the audience who are listening to you today. Let me therefore sum up what you said and repeat it, just so that people have a clear understanding. What we're doing is we're taking the Chinese statistics, because the fact that the country has the same size and scale and density of population as India, but because our health system is nowhere near like theirs, we're multiplying their results by 3. And so 82,000 affected in China would become 250,000 affected in India.
Yes.
3,300 dead in China would become 10,000. You're saying let's even make it 12 or 13,000.
Yes.
That is what you would say a reasonably sensible ballpark figure to work on for India at the moment.
This would be the upper limit.
This would be the upper limit.
Absolutely, because we are tripling the numbers.
Let me put that figure of 10 or 12 or 13,000 dead at the end of 5 months in some sort of perspective. India's death rate is 7.2, 7.3 per thousand. Per thousand,
Yes.
not percent.
Yes.
And that comes to just under 10 million people dying every year. You're saying that coronavirus will add to that roughly 10 million deaths a year by about 10, 12, 13,000.
We double that, it will be 20,000, because we're talking about 5 months. Let's take it over a year, so that'll be 20,000. Even then, it's still a blip.
It's a blip.
It's a blip.
20,000 deaths is a blip of the
Yes.
total 10 million people who die under other
Yes.
circumstances every year in India.
Definitely.
Let's then, having put this into perspective and keeping it in the background, come to two other critical concerns. The first is, what do you believe is the main purpose, the main intention of a 3-week lockdown? To what extent is the intention to actually kill the virus by reducing infection? Because if you kill off the infection, the virus will die. To what extent is that the real reason for the shutdown?
The virus won't die because the virus would probably cling on to some people. You can't eradicate the virus because the virus it'll be impossible for the virus to be eradicated. The people would be getting affected. The lockdown cannot be complete. People are moving out.
Isn't that the problem?
Yes.
If your intention behind the lockdown is to, in fact, ensure infections stop and therefore the virus dies because the virus no longer lives, it only lives by passing from person to person.
True.
If that's the intention behind the lockdown, then you have to have a total lockdown. You can't allow essential services to continue because those will allow infection to continue and that will keep the virus alive.
But I suppose even not a partial, but a large lockdown would stop the infection rate.
But that would mean a very effective, large lockdown.
Yes.
Not
yes.
one where
We don't
several
know, because
items are specified as essential
yes.
services and excluded.
Yes, we're not clear about this because look, we are moving with history here.
And learning as we go.
Learning as we go. Things keep evolving every time.
Let me then put you an alternate view. To what extent is the principal purpose behind the lockdown to flatten the curve so that the number of people falling seriously ill at any point of time doesn't overwhelm the Indian medical system?
Look, that's a very laudable effort, flattening the curve. But the problem is do not ignore the fact that there are other diseases prevalent in this country also. There are lakhs and lakhs of people dying because of heart attacks. There are lakhs of people dying because of diabetes, lakhs of people dying because of lung disease. You have almost 3,000 people dying in a day due to tuberculosis. And I can presume that 2,000 of them are dying in India. So when you flatten the curve, there is a purpose behind it, but we cannot ignore the fact that there are other diseases also. You see, you are flattening the curve with the thought in mind that you do not want your hospitals to be overwhelmed by coronavirus. But then, you cannot ignore the other diseases.
I take your point, but just for argument's sake, let's come back to this central issue. If the principal motive behind a 3-week lockdown is to flatten the curve, then is a 3-week lockdown sufficient? Because the virus will still be there. The second you lift the lockdown, people will start getting affected, and very quickly you'll get to that point all over again where the number of people falling ill or that could fall ill will threaten the medical system.
Exactly. So therefore, you need other measures. You need to be specific. You need to be more pointed in your approach.
Well, one of the things you're suggesting is that if a 3-week lockdown is not sufficient because the virus will pop up again and we'll be back at the same point of worrying about the system, the medical healthcare system being overwhelmed, is that you need a prolonged lockdown or you need repeated lockdown. And either or both of these need to continue till such point as the heat in summer kills the virus. If that happens, we don't know for sure if it will, or someone invents a vaccine.
Look, I'm not going to wait for the vaccine because the vaccine is going to take a year, 1.5 years. on a normal basis. But I understand they are they're shortening easing the regulatory processes, and they want the vaccine to be around in 6 months to 8 months or 9 months time. But that is very difficult. That is not
What
scientific.
about the other possibility that you need a prolonged lockdown till such point the heat in the Indian
yes.
summer kills the vaccine? What are the chances the heat will kill it? Because there seem to be two opinions about that.
No, that is a very good point, because we have data from the SARS epidemic. We have data from Hong Kong which clearly says that when the temperature went above 29 degrees centigrade, then the virus disappeared. So one can presume to a large extent, because this virus is a cousin of the earlier virus.
And I believe MIT has done a study which suggests that in fact 94% of the infections are within a very narrow latitude band. And those are all cold countries.
Cold countries. Their threshold was 17 degrees Celsius. So 94% of patients were in areas where the temperature was beneath 17 degrees Celsius, which means now that when the temperature goes above 30 degrees here in India, in Delhi, one can safely presume that the infectivity rate will go down.
So when in April, and April is now just a day and a half away, temperatures start rising appreciably above 30, you believe chances of the virus dying in the heat keep growing?
Definitely.
As a doctor, you're reasonably confident of that. And I only say that because others have a lot of doubt. The WHO has officially said we can't count on the summer heat killing the virus. You believe that actually the chances it will are pretty good?
I think the spokesperson of the WHO probably didn't read up the data. So there is data that is published.
MIT in particular?
MIT and particularly the data which came with SARS.
Okay, let me put this to you. Even if there is validity to your confidence that the heat will kill off the virus, the only way you can keep the curve flattened, and that's the purpose of this present lockdown that we're going through, is if you keep extending it, either non-stop or with small little breaks so people can have a breather, but keep extending it till such point that the summer heat does kill the virus. Because every time you relax the lockdown, the virus will pop back up and you can once again face that spiky curve.
No, I don't look at it like this, because we just spoke that the prevalence in India is very low, is very little. The death rate is also very low. Probably it is because of the temperature. Already the temperature is playing its part, right? And I don't think we should carry on with these lockdowns forever. You have to stop them. You have to stop them, because
given your viewpoint, let me put you what is implicit in the strategy the Indian government has adopted to tackle coronavirus. That strategy is predicated upon the effectiveness of the lockdown. And what the lockdown means is that hidden in this strategy, implicit in this strategy, is severe economic damage. And for the poor and vulnerable, these are people who are losing their jobs, who are hungry, if not starving. It also means some of them will die. That is the cost that is implicit and inherent in the strategy, isn't it? That's one reason why I was saying we can't keep continuing with it.
You see, because these lockdowns, you've already seen there is hysteria, there is mass hysteria, there's an exodus of thousands of people, going back to their hometowns, which is very, 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 very disheartening for a viewer, and especially for these poor people. There will be tremendous economic damage. I understand already the stocks have gone down by 25% or 30%.
And newspaper reports are suggesting that already something like 20 people of those tens of thousands who tried to walk have died.
Sadly, yes.
And we don't know how many more will suffer. Hopefully none, but we just don't know.
You see, we have an idea of the infectivity. We have an idea of the death rates because of the virus, but we still don't have any idea of the impact of this virus on the economy, on the social structure, on the social fabric,
and on people's lives,
and on people's mental status.
So what you're saying is, given the economic damage, both in terms of the economy as well as on people's lives and the poorest and the most vulnerable, you believe a prolonged lockdown or a repeated set of lockdowns is inadvisable. And you're saying that because, given the weather conditions, given what we know of the infectivity rate and the death rate in India, you think it's also unnecessary. It's both inadvisable as well as unnecessary.
I would second you.
You would agree?
I would agree to a large extent. It's a very difficult choice. One has to balance the lockdowns with the economic damage, but somebody has to, take the call.
And to just clarify your position, you're saying this because you believe, using the Chinese example and extrapolating by a factor of 3, the total number of people who will be infected over the next 5-6 months in India, and you said this was at the extreme end, would be 250,000, and as a result, the total number of people who will die, sadly die, will be around 10-12,000. And given that, you think the costs of the lockdown may be inadvisable because of the damage the lockdown does.
Yes, they're not balancing each other.
Well, we're coming into now a debate that is morally a very difficult one. I nonetheless still want to get into it because I think an informed democracy needs to discuss these issues no matter how morally troubling they may be. It's only when we've convinced ourselves of the right or wrong on either side that we'll be confident as a country of what we're doing. And secondly, this is a debate that has been touched upon in America in that particular specific context by President Trump, and it is happening in Western newspapers. The columnist Thomas Friedman has raised it. Professors of philosophy in America have raised it. It's all over WhatsApp. And the debate, I suppose, in Indian terms, hinges on this question. And I put it to you with great hesitation, but it's a question that must be raised. How much economic loss and how much loss of lives due to starvation and destitution is acceptable to save what you believe will be 10, 12, 13,000 deaths from coronavirus?
Now, I've already given you the answer. They don't balance each other. Even if 20,000, 25,000 people die of coronavirus, it's not worth smashing your economy. It is just not worth smashing your economy because that money is required again for the health system. It has come back to the health system also at some point of time. You cannot have lakhs of people unemployed. That would ruin the system. We already have a sputtering economy right now. We just cannot afford this total lockdown for too long period.
We're entering into what the world calls an economic health versus medical health debate. Do you think this is a debate that India really must not just have with itself, but have exhaustively so that the country knows what are the costs on either side?
Absolutely. I agree with you fully on that.
This is a debate we must have.
Yes, we must have this debate. We must have this discussion as to how do we balance this.
So the moral compunctions that some people feel when they have this debate are actually mistaken and misleading. These are difficult issues, but we must as a country
address
ask the question and address them.
Yes, we must do that.
Now there is something else perhaps even more troubling that lies behind the debate, and this is perhaps peculiar to India's conditions. The lockdown was imposed to ensure that people who came from abroad with the virus didn't infect others, and those that they'd immediately affected didn't affect others either. And we're therefore talking about some 10-15% of the population, the top population, the richest people. But the people whose lives are devastated by the lockdown are the daily wage workers, the agricultural, landless, rural workers. These are people who are poor, they are hungry, and we know that some of them will die. And they are the bottom 10 or 15%, and they are poor. So suddenly this debate in India has exposed the dreadful fissures that run through our nation and our society.
Very much, and these fissures will be seen in the West also. Even in the West, you will have a difference between a white Anglo-Saxon who's 75 years old and a Hispanic or a Caribbean.
Let me put this issue in crude, blunt terms, and I accept they're crude, blunt terms, but that's how it was put to me by someone, and it shook me when I heard it. There is a sense, and I don't want to put it more strongly than that, there is a sense that the lockdown helps protect the top 10-15, but the terrible price of the lockdown is paid by the bottom 10-15%. It's a sort of, and I'm putting it crudely, rich versus poor, or what sometimes is called India versus Bharat.
Now that is a question which can be best answered by a social scientist. I am a physician, a clinician, and I would say that I look at it in this way, that the lockdown will affect just about everyone. Middle class, lower class, upper class.
But
everyone
the
will be
upper
affected.
class and perhaps the middle class have a better capacity to withstand the rigors of the lockdown.
Yes.
The poor, the daily wage worker,
Definitely, yes.
They
That
don't
is
have
true.
that
That is
capacity.
true. That is true.
if anyone dies of starvation, it will be them, not us.
Not us. Not us. And people will die of starvation if this thing carries on.
In which case, let me end part one by putting this to you. If at the end of 3 weeks, the government decides a further lockdown is necessary, and I know that the Cabinet Secretary today has denied speculation that the lockdown will be extended. But remember, the date for extension is still over 2 weeks away. It only ends on the 15th of April. So if by the 12th, 13th, 14th, the government feels it needs to be extended, would you suggest that instead of a national lockdown, it should be more targeted? Targeted at the elderly who are particularly vulnerable, at the very young who are vulnerable, targeted at communities that live in cold temperatures where the heat of summer may keep the thing simmering. Would you say a targeted extension is better than another national one?
A selective quarantine is far superior, would be far superior, far more logical than a total lockdown. You need to separate the elderly people, you need to separate the vulnerable people, people who have diseases, and you have to protect your health personnel.
And this would be your advice to the government?
Absolutely, yes, very much.
Professor Ganga Khetkar of the ICMR said on Saturday that only 30% of Indian government-owned testing facilities were being used, and he confirmed this yesterday, Sunday as well. And therefore, I want to put this to you. If 70% of our testing facilities are not being used, are we testing enough?
No, we are not testing enough. We have to test many, many more. We are not a poor country. We are, I think, the 6th to the 7th largest economy in the world. And we have examples. We have the Singapore example where they've tested, very many people. We have the Korean example. We have the Iceland example.
And Germany.
And we have the German example. The more people we test, the more clearer the picture in this country.
Now, last week we discovered that the doctor working in a mohalla had been infected by someone who had come from Saudi Arabia, and the doctor had thereafter tested positive. Now, in response, some 900 people were identified that had been in contact either with the doctor or the person from Saudi Arabia, and they were all quarantined. But shouldn't these people actually have been tested?
They could have been tested, but at least I hope they were quarantined. That is very important. They have to be quarantined.
Well, the government says they were, but no one knows how effective quarantining is because it can often be breached. And in fact, given that quarantining can be breached and has been breached, should these people have been tested?
They should have been tested to give us an idea of what is happening. I think a paper was published just 2 or 3 days back in the NEJM about this matter. There was a single lady. Can I talk? Do we have the time?
Yes.
There's a single old lady who developed this virus and a pneumonia and died. But she infected 150 people. 50 healthcare workers. She was in a nursing home. And 100 other residents. So what came out was that of these 150 people who were infected, almost 1/3 were asymptomatic.
But if you had tested them,
you would have picked them up.
And
right?
they would stop them from infecting others.
And the other information which comes out is that the mortality was 30% in the people who were the residents. But the average age of the residents was 83 years.
Because this is an old people's home.
Old people's home. Then whereas the medical personnel, nobody died.
So the two examples you're giving actually corroborate and support that it would have been sensible to test the 900 people, the mohalla doctor and the patient or the person from Saudi Arabia had infected rather than just quarantine them. But let me put this to you. A couple of days ago, the government actually announced officially that they were changing their testing policy, and thereafter they said anyone who's been in contact with someone who's tested positive will be tested, regardless of whether they're symptomatic or not.
Yes.
But by not testing these 900 and simply quarantining them, the government has actually breached its own latest guidelines.
Definitely.
So this is strange. I mean, here's the government saying by changing policy and we'll do A, but the first opportunity to do it, and they end up doing something else.
But they've rectified their program now. At least now they're saying they will check close contacts, even though they're asymptomatic. So that's one step forward.
Let me put this to you. Even before this 900 were identified who'd met the mohalla doctor, the government had actually rectified its thing. They'd announced before these 900 that they would actually test anyone who came in contact.
If not 900, they should have tested 400 or 500. Then we would have had some idea of what is happening.
So this is why it's worrying, because you have on the one hand the government saying we'll do A.
Yes.
At the first opportunity and the first need to do A, they actually do something quite different. This doesn't reassure people, does it?
No, it will not. But there is another angle to this, okay? Now this, I hope this is not confusing, but there is another angle. You have this excellent paper from Singapore, wherein they quarantined 450 people who came in contacts with confirmed cases. Of these 450 people, all were quarantined. I think only 2 or 3 developed the disease. So the transmission was very low.
So in some situations like Singapore, quarantining may be sufficient.
Yes.
But does that apply to India?
But the fact,
does that
no,
apply to?
But because they quarantined them, because they followed them, we have the information. So
but
we
in India,
must,
where you know
we
the
must do this.
quarantining
Yes.
isn't sufficient
Yes.
because it's so easily breached, you still believe testing these 900 would have been the sensible thing to do?
Yes, if not 900, at least 200, at least 400.
Let's broaden the discussion.
Yes.
Do we need to do random testing so that we have a much clearer and more confident idea how far coronavirus may have spread? When asked, Dr. Ganga Khedkar insisted on Saturday there was no need for random testing. What's your opinion?
No, I disagree with the, with due respect to this gentleman, to the professor. I think it is imperative, I think it's very important that we as a nation, we start testing, a large quantum of people, maybe 5 lakh, maybe 10 lakh in different parts of the country, so that we get an idea of this virus, what is the infectivity rate and what is the prevalence of the virus and how many people are dying. If we do not have that data, all our discussions will be intangible.
Then let me go one step further. On Saturday, at the regular press conference the ICMR holds, Dr. Ganga Khedkar was asked that there are a handful of people, admittedly only a handful, who have tested positive. They have no travel history. They have no knowledge of meeting someone else who was infected or positive. Yet this handful have got it. And Dr. Ganga Khedkar didn't deny the existence of this handful, but he did again pointedly say that this was not a cause of concern. And his explanation was that this is statistically meaningless. And I accept that in a population of 1.3 billion, a handful of people may well be statistically meaningless. But given Indian conditions and given Indian concern, would you agree with that attitude?
No, I would go the whole hog. I would be very enthusiastic about testing, a large number of people, we must have a large random sample so that we have an idea of what is happening in this country.
So you think there's a certain amount of, what's the correct adjective, complacency in the Indian system when we're not testing more? Or are we, if complacency is too strong, being confident on too narrow a basis to justify that confidence?
I think it's overconfidence.
Overconfidence.
Yes.
Now, let me come to one other issue. There have been reports in at least one academic journal in the West that in fact, because the coronavirus can linger in small fine particles called aerosols, its transmission may have become airborne. It may not strictly only be by droplets. How seriously do you take that research? How convincing is the case they make?
No, the research is very nice, but that is an experiment that cannot be translated into clinical conditions. People should not panic, right? I mean, there is a half-life. The virus, it gets disintegrated. So it doesn't last all those 3 hours, and there is no proof that at the end of 2 hours the virus is infective. So that is very important. The experiment also says that there could be transmission by fomites. That is, if somebody sneezes on a package of paper or cardboard, in fact, the virus can live there for 24 hours. But that simply means that the virus is, the virus is present there for 24 hours on the paper, on the cardboard, but doesn't mean that the virus is still infective. There's a difference between the two.
And that's an important distinction.
That's a very important distinction.
So if I understand the point you're making about this research presented in the West, that the research itself is good quality research, but the conclusion, and that conclusion may have been made by the media rather than the people who did the research.
Exactly.
That
yes.
this proves
yes.
the virus has become airborne and no longer droplet-borne. That conclusion you're saying is unjustified or largely unjustified.
Largely unjustified, yes.
But that suggests that there is an element of airborne communication.
There is, yes, because all flus are infective because of air. Because when we sneeze, when we cough, even when we are talking, we are releasing droplets.
But it's
right?
not the situation where if you walk into a room where someone positive has been, say, 2 hours ago, you'll pick it up
yes,
because they were there.
No, I doubt very much, because the virus would have died by then.
Okay, let me come to something else. China has been able to reduce its domestic infections, I'm talking about domestic infections, to about 1 or 2 at the most. And in fact, they've had some days, 3 at a stretch, when there were no domestic infections at all, as a result of which Wuhan and Hubei province as a whole have started to open up. But there are people who point out and say that China could experience a second wave in 3 or 4 months' time. After all, they point out this is precisely what happened in 1918 with the Spanish flu. How likely is a second wave, or do we just not know?
No, second wave is bound to come, but the fact is that now we have experience. The Chinese have the knowledge of how to tackle the problem, number one, how to handle themselves, how to manage the problem, and number two, there will be immunity in large chunks of the population. So therefore, either the virus mutates to a small extent, but the impact now, the next wave will not be as much as the first wave.
So you're saying that a second wave is bound to come, and that means it's not just bound to come in China, it will
come everywhere.
Everywhere.
All over the globe, yes.
But all of us will have learned from the experience of the first wave.
Yes.
And in addition, all of us will have a higher level of immunity when the second wave comes.
If not all of us, a large number of people would have some immunity.
So the second wave is not something we should live in terror of?
Absolutely not. Absolutely not. There is an ulterior motive in highlighting this second wave.
And the second wave, or the possibility of the second wave, is not a reason for extending the lockdown either?
No, that'll make no sense.
Let me then come to a final question. A lot of people in India say that we Indians are probably exposed to more varieties of viruses than anyone in the world. Could it therefore be the case that there's a certain inbuilt immunity that will either slow down the spread of the virus in India or at least reduce the severity of whatever illness follows?
No, I doubt very much, because clinically we have the largest pool of patients infected by tuberculosis. If we had some sort of immunity, this sort of immunity, then we wouldn't be the largest pool of patients of tuberculosis. So that's a very simple clinical answer.
And in fact, you would also say, and I'm asking you this as a question, that this belief that somehow our environment or our conditions have made us special and different to the world doesn't hold true. We will suffer more or less the same way.
By and large, we are more vulnerable than the rest of the world in connection with most diseases.
Because we are weaker and our, therefore, bodily immunity is less?
Possibly either because we are weaker, or possibly we are ill-informed.
Ignorance plays a big role.
Ignorance is a huge, yes. Ignorance is the biggest player.
Dr. Natrajan, we've been through a whole gamut of issues. I'm particularly grateful for you that you've answered these, because these are the sort of concerns people who've been reading as widely as they want about coronavirus will have in their minds. And I'm particularly grateful that you helped discuss and shed light on that critical moral debate, what I call medical health versus economic health. It's a debate that people find troubling, but it's a debate that a democracy must have, because only when we are confident of what we are doing and why we're doing it will all of us back it. I'm very grateful for this interview.
Thank you very
much indeed.
Thank you very much. Thank you.
To receive instant updates on all videos from The Wire, click the subscribe button and hit the bell icon. Pay to support independent journalism. Click the link in the description and choose the amount you want to pay.